This is Dr. Edward Gaber. This is the first of my Live to 100 newsletters. There are three important risk factors concerning when it comes to keeping our arteries whistle clean and pliable. These are hypertension, blood sugar problems, and lipid problems. And by controlling these three things, we can prevent strokes, vascular dementia, heart attacks, heart failure, peripheral arterial disease, kidney disease, impotence, and catastrophic intestinal artery obstruction. Total cholesterol levels give very little information on our risk of vascular disease. And in the past, we also thought high HDL was protective. This is no longer the case. The most important level to measure is apolipoprotein B. That level should be 50 or less, and even less if the patient has elevated Lp(a), which adds about 17 points in risk to the bad cholesterol. Triglycerides have some importance, but the ApoB also measures the bad cholesterol in the triglycerides. If triglycerides are very high, we worry about pancreatitis and lipemia retinalis in the eyes, and we treat the triglycerides with fenofibrate drugs. Next year, medicine will come out treating Lp(a), but right now all we have is Repatha, which can only lower it by about 15%. The best medicine to treat cholesterol is rosuvastatin or Crestor. It is water-soluble and cannot enter the brain to cause memory problems like some of the other statins, which are fat-soluble. It has very little drug interaction as opposed to atorvastatin or Lipitor and simvastatin or Zocor. These latter drugs can have serious drug interactions with many medications, including especially antifungals and Biaxin. The chance of Crestor causing muscle problems is infinitesimal. The chance of cholesterol hurting you is 100%, so it's well worth the risk. Statins are so safe now, we are giving them to young children. As the earlier they are started, the more effective they are in preventing heart disease. 10% of people have mild muscle aching the first year of taking a statin. This has no clinical significance. Multiple studies showed statins do not cause neuropathy. Liver biopsy studies showed the chance of a statin hurting your liver is 0. And in fact, studies show now that statins help the liver. Since 80% of Americans have fatty liver, and a certain percentage of fatty liver patients progress to cirrhosis from the inflammation from the fat in the liver, this is an important benefit of statins also. Now, 1% of people may have a mild bump in liver enzymes with Crestor. It is totally reversible and does not hurt the liver. Serial liver biopsy studies have shown this. We check liver enzymes every 6 weeks for the first 12 weeks, and then every 6 months when a patient is on Crestor, and we also check the muscle enzymes at those times also. Since we have a 40% chance of dementia or mild cognitive impairment after 85 and a 50% chance of frank dementia after 90, it is important to understand that at least 30% of dementia is vascular dementia and can be prevented by controlling cholesterol, blood pressure, and blood sugar. Statins also protect soft cholesterol plaque from rupturing and causing sudden strokes, heart attacks, or sudden death. Statins decrease that risk by 55%. If someone's taking an ARB or ACE inhibitor for blood pressure, that adds another 45% decreased risk of plaque rupture. So that's 100% less chance of plaque rupture. Tim Russert, former moderator of Meet the Press, died at 58 of cholesterol plaque rupture in his left anterior descending coronary artery 2 months after a normal stress test. The plaque had only narrowed the artery by 40%, so he easily passed his stress test and he was not having any chest pain. This is an example of how every 9 minutes a cardiac arrest occurs in the United States. And the first manifestation of cardiac disease is most often sudden death. And now we can easily prevent that. Go to my website and see Dr. Gaber's favorite videos to see further discussions on ApoB and Lp(a). My website is edgabermd, edgabermd.simdif.com, or call 985-624-5410 to subscribe to my $10 a month Live to 100 newsletter. I hope this can be helpful. Thank you.